So hello everyone, welcome to the Zoom meeting on Saturdays, and thank you everyone for showing up. And first of all, Ramadan is finished, so hopefully everyone will accept Rabbana subhanahu wa ta'ala accept your Eid. Wishing you all the best. Eid Mubarak to you all, wherever you are, here in the US or around the globe, with best wishes. And hopefully next year we'll have good news for everyone of you guys. And second of all, our prayers goes to those fellows, their families, and anyone here with their families in Sudan. Hopefully things will calm down and peace will start there. For those who are there, hopefully you will stay in a sheltered place. Hopefully you are safe and your families are safe. We understand that you are going through a tough situation, tough position there. Hopefully things will get better soon. So for today's meeting, we have an agenda, but we modified it. So I'm gonna just share with you guys. So the green team is supposed to start. So we will start with one topic, which is here. So we'll talk about hearing loss in older adults. We'll focus on that. And then we will touch base on some of the other agenda topics, including selecting residency, keeping database, and searching it, and then Canva, maybe tutorial. We will discuss. So I anticipate that every one of you will participate in the discussion, and then maybe we will get some updates as far as what's the projects going nowadays. So I know there is one presenter we will have a presentation in Boston on Monday, and then we will talk about the apps and the development and updates there. So when you are ready, the green team.
Assalamu alaikum, Dr. Nader. My name is Yaseen. I am the lead for the green team. So I'll be presenting the first topic. Unfortunately, the rest of the group, a lot of them, they're in Sudan. They're not able to attend due to these circumstances. So I will be presenting the first topic, and the second topic will be presented by Dr. Liena. So let me share my screen. Okay, just a second.
Sure.
Everyone can see my screen?
Yes.
Yes, we do.
All right, okay. All right, guys. So I'm going to present the topic of hearing loss. So basically, we're going to describe the following: the normal mechanism of normal hearing, the common causes of hearing loss. Just a second. Just minimize this. The common causes of hearing loss, the management and treatment options for hearing loss, and the strategies to improve communication with adults with hearing loss. So normal hearing, age-related changes, epidemiology, perspicuous, clinical presentation and hearing loss detection, evaluation of suspected hearing loss, and treatment of hearing loss. Okay. So basically, what's the impact of hearing loss? The fourth most common chronic disease among older adults. It's often assumed to be benign, but profoundly affects quality of life. Many contribute to family discord, social isolation, loss of self-esteem, anger, depression. Treatment can improve quality of life by facilitating interaction with family, friends, and caregivers. So basically, the impact of hearing loss has such a psychological effect on the patient, where they're always feeling isolated. They cannot communicate with people in a normal fashion. So their mental health is very important. That's something that we need to obviously become more aware of. So the normal hearing, basically it's a sound energy that is transmitted through the external ear to the tympanic membrane and auditory ossicles. Malleus, incus, and stapes transmit vibration to the oval window of the cochlea. Fluid waves stimulate outer hair cells, which stimulates inner hair cells. And the inner hair cells generate impulses that are sent via cochlea neurons to the cochlear nuclei and then to auditory pathways elsewhere in the brain. So if they have any dysfunction in these parts that we have just explained, we're always going to have some hearing loss. The age related changes that can interfere with the hearing. External ear canal, the walls become thin and the cerumen becomes drier, more tenacious, increasing likelihood of impaction. Tympanic membrane becomes thickened, appears duller, and the cochlea, the hair cells and fibrocytes in the organ of Corti are lost. Basilar membranes will become more stiffened, and the auditory structures will calcify. Cochlear neurons are lost. The stria vascularis, the capillaries becomes more thick, the endolift production would decrease, and the sodium potassium ATPase activity would decrease. So over here with the epidemiology of hearing loss, we have more prevalence in the age of 65 to 75 years old in 10% of the population, and over 75 years old in 25% of the population. So basically it would increase with aging. Causes and types of hearing loss may be caused by the following pathology in the external ear canal, the middle ear, the inner ear, the auditory nerve, central auditory pathways, and it could be a combination of these things. The categories of hearing loss based on causes. So it could be conductive, could be sensorineural, and it could be both. So this is a graph that would show us what's a normal audiogram looks like. Basically, it shows the hearing threshold and the frequency of the sound. On the next few slides, I'll show you guys the abnormal audiogram, how it would look. So when conductive hearing loss, we have external ear pathology. So we have two pathologies, either it's external or it could be middle. So the external ear pathology could be due to cerumen impaction or a foreign body. The middle ear pathology could be otosclerosis, cholesteatoma, and tympanic membrane perforation or middle ear effusion. So any of these pathologies would cause conductive hearing loss. So this is the graph of how it would look if we would have conductive hearing loss. Obviously, the hearing threshold would decrease, impacting the hearing. So most common, just a second. So most common, most often from aging, noise damage, or ototoxicity. This is for sensorineural hearing. We have any cochlear diseases. These are the most common ones, and often from noise damage as well. The other causes could be due to ototoxic medication. It could be due to genotype, vascular disease, occupational and environmental chemical exposures, which are becoming very rare nowadays. In autoimmune disease, they're also rare, and auditory nerve tumors. So this is the graph of the sensorineural hearing loss. As we can see that the hearing threshold would decrease drastically as the frequency would increase. So this is how it would look if it was mixed hearing loss. So at any frequency that we have, the hearing threshold is decreased and it's below normal. The second thing that we're talking about is presbycuosis. Is basically sensorineural hearing loss, usually symmetrical, may have central components, classified by cochlear pathology, sensory, neural, strial, cochlear conductive, combined or indeterminate. In these kind of situations, the use of amplification would be more helpful. Then the types of presbycuosis is sensory presbycuosis, and this is the loss of sensory hair cells in basal end of cochlea, slowly progressive loss, beginning with higher frequencies, difficulty hearing in presence of background noise. The treatment in this situation would be amplification. And when it comes to strial presbycuosis, results from atrophy of the stria vascularis. The onset is at a young age, from 20 years old up to 60 years old. It's mild to moderate hearing loss in most frequencies, usually good speech discrimination, and the treatment is also the same. Neural presbycuosis, we have cochlear neural loss of 50% or more. Poor speech discrimination, amplification is usually not successful in these situations. Cochlear conductive presbycuosis caused by changes in cochlear mechanics produced by mass or stiffness changes or spiral ligament atrophy. Audiogram descends gradually over at least five octaves. Speech discrimination is impaired in this situation. So when it comes to clinical presentation, many older adults are unaware of their hearing deficits. Hearing loss can be interpreted as cognitive impairment. Tinnitus can be an early sign of hearing loss. It also may fail to respond. They may fail to respond to requests or respond inappropriately due to misunderstanding the speaker. Others may complain about loud TV, which is the normal presentation that you would usually find with patients. Hearing loss, for hearing loss detection, hearing handicap inventory for the elderly. So it's like a screening version. We have also the whisper test, and we have the handhold otoscope with a tone generator, and apps and online hearing tests. So that we can use any of these for to test for hearing loss. Evaluation or suspected hearing loss, exclude causes of hearing loss that are readily treatable or warrant referral to an otolaryngologist before signing medical clearance forms for hearing aids. So we examine the ear canal with an otoscope to exclude obstruction such as cerumen impaction or effusion. Then we would review the medication list for potential contributors for ototoxicity. So the other question is that we need to ask is that when can we refer the patient to ENT? We would first consult for asymmetrical hearing loss, which may indicate tumor of which next room. Now I'm taking big risks by which may indicate tumor or posterior pharynx blocking the Eustachian tube or auditory nerve tumor. Cerumen impaction not responsive to cerumenalytics, irrigation, or manual extraction, or in patient with a history of tympanic membrane surgery or perforation. So these are the situations we would have to refer the patient to ENT. When to refer to audiologist. Consult to determine the presence and the type of hearing loss, recommend and fit hearing aids, and provide auditory rehabilitation. And then assessment includes evaluation of pure tone thresholds for both air and bone conduction, speech recognition thresholds, speech discrimination, and middle ear functioning. Treatment of hearing loss. We have medical or surgical, and we have strategies to enhance communication and assistive listening device, hearing aids, or cochlear implants. So when it comes to medical causes, it could be the first cause could be Paget disease. It could be otosclerosis. It could be also bisphosphonates and sudden hearing loss due to corticosteroids or immunosuppressants. Surgical would be otosclerosis, tympanosclerosis. Strategies to improve communications are such as ask the listener to what is the best way to communicate with him or her, obtain the listener's attention before speaking, eliminate any background noise as much as possible, be sure that the listener can see the speaker's lips. So speaking face to face in the same room, do not obscure the lips with hands or other objects, and make certain that light shines directly on the speaker's face, not from behind the speaker. Also, speak slowly and clearly, but avoid shouting. Speak toward the better ear if applicable. Change phrasing if the listener does not understand at first. Spell words out. Use gestures or write them down, and have the listener repeat back what he or she heard for confirmation. For assistive listening devices, there are pocket-sized personal amplifiers, telephone equipment amplifiers that vibrates and flashes, flashing ringers, alert devices, and text telephones. Television listening devices, vibrating and flashing devices from an alarm clocks and timers, smoke alarms, doorbells, and motion sensors. FM loops and FM or infrared transmitter receiver systems for groups. Hearing aids, there are two are better than one. So not everyone can benefit from it. For example, those with poor speech discrimination and who are unable to tolerate the presence of the hearing aid in their ear. There are two types of these hearing aids. There is analog, which is less expensive, but rarely sold now. And there are digital, which is smaller and you can basically customize it. When it comes to the effect of rehabilitation of hearing loss, so it depends on the degree. If we have mild degree, the patient could have would have 25 to 40 loss in decibels. Then basically they can hear the sounds that are difficult for them to hear are whispers, and the effective communication is very difficult for them to understand soft speech or normal speech in presence of any background noise. Hearing aid needed in specific situation for them. When it comes to moderate, there is 41 to 55 loss in decibels. The sounds that are difficult for them to hear are conversational speech. Then also the effect of they have basically difficulty understanding any but loud speech, and they would frequently need hearing aids. For severe, there's going to be a 56 to 80 loss in decibels, and they would have difficulties hearing shouting, vacuum cleaning, or anything that's basically loud. Effects of communication that they can understand only amplified speech, and also amplification needed for all communication for these patients. When it's profound, there is more than 81 loss in decibel. They would find it very difficult for them to hear hair dryers, heavy traffic, telephone ringing, and it's difficult. So they have also difficulty understanding amplified speech, may miss telephone calls, and they may need to supplement hearing aid with lip reading, assistive listening device, and sign language. Styles of hearing aids. We have completely in the canal, we have in the ear, behind the ear, body aid, bone conduction aid. So for the completely in the canal hearing aid, it is basically used for the degree of loss of mild to moderate. Their advantages is that they're almost invisible, so there's less occlusion of the pinna, more natural sound, and it's easier for them to use with headphones and telephones. There are disadvantages that users' dexterity may be a problem. Small size may limit available features, may cost more than a canal or in the ear aids, and they have a very short battery life. For the canal hearing aids, basically it's for the degree of loss of mild to moderate. Their advantages is that they're more cosmetically appealing with larger than larger aids. Telecall available in some models, may be able to use with headphones. Disadvantages that the user's dexterity may be a problem. Small size may limit available features as well. And in the ear hearing aid, these ones are used for the moderate to severe. Their advantages is that they're easy to handle, they're comfortable, and their options that they have telecoil, directional microphone, and more power than completely in the canal or canal aids. Their disadvantages is they're more conspicuous than completely in the canal or canal aids. May be difficult to use with headphones as well. For the behind the ear hearing aid, it is used for mild to profound. Their advantages is that they have greater power. Their options that they have telecall, directional microphone, direct audio input. Ear mold can be changed separately. And their disadvantages that they're more conspicuous, may be more difficult to insert than in the ear aids, and they're difficult to use with headphones as well. Body hearing aids, they're used for severe to profound degree of hearing loss. Their advantages is that it greater separation of microphone from receiver reduces feedback. Disadvantages are they're more conspicuous. They pick up noise from rubbing on clothing, so they're very sensitive. Microphone is at chest or on waist, but speech is directed at ear level. For the bone conduction aid, degree of hearing loss is mild to severe. Their advantage is that they bypasses middle ear, used if ear canal is unable to tolerate aid or ear mold, or for unilateral hearing loss. Disadvantages is that the receiver causes pressure on scalp, which can be uncomfortable for some people, does not correct sensorineural loss, and being replaced by bone-anchored hearing aids. So when it comes to cost of these hearing aids and assistive listening devices, we have the assisted living device. It's relatively cheaper. It costs around $100 and up, and it's useful for specific situations only. When it comes to hearing aids, it's either that you get one piece or two piece as a pair. There are different types. There is they have economy, value, and mid-range and premium. So when it comes to economy, it basically will cost 1,200 for one and 22 for both. These ones are slower. I have slower signal processing. Have fewer options, useful for quiet lifestyle. The value ones are relatively more expensive. They have multiple programs. Telecall usually is available. And for the mid-range ones, those ones are obviously more expensive. They have multiple programs, telecall, Bluetooth input, and the premium one is the most expensive option. It has multiple programs, telecall, Bluetooth input, or more rapid signal processing. So obviously, depending on how the patient, exactly what the patient needs, then they can basically be assigned to whatever hearing aid that they would see fit. So over-the-counter aids, basically recently approved by the FDA for sale in the USA. Those ones are sold directly to consumers. The quality would vary from poor to good, and encourage consumers to have hearing tests before purchases. Caring for the hearing aids, so store with battery compartment door open. Leave the battery door even partially shut, may drain the battery. Wipe dry with a dry cloth daily. Consult manufacturers' instructions prior to cleaning wax from sound outlet. The cochlear implant. That's the next thing that we're going to talk about. Is it's an electronic device that bypasses the function of damaged or absent cochlear hair cells by providing electrical stimulation to cochlear nerve fibers. Implantation requires extensive pre-implant testing, post-implant training, and general anesthesia. Cochlear implant procedure is covered by most Medicare carriers and insurance companies, although prior authorization would be required. Outcomes for adults over 65 years are comparable to those of younger adults, with excellent audiologic and quality of life measured. So in summary, hearing loss would occur commonly among older adults and may lead to reduced quality of life, high medical care costs, and loss of independence. And primary care providers should routinely screen older adults for hearing loss. And treatment options are available for many types of hearing loss. If everyone is ready, so the first case that we have is that it's a 72-year-old man, has difficulty hearing, dating back about 5 years. He is accompanied by his daughter. Both are concerned about what is causing the hearing loss. The daughter says that he sets the TV volume excessively loud, often does not understand a phone conversation, and has difficulty participating in conversations in noisy environment. The patient has no tinnitus, vertigo, otolalia or discharge from the ears, and has had no ear infections or trauma. Which of the following is the most appropriate initial step in evaluating the patient's hearing loss? You guys can write your answers on the chat. Yeah, I can see the answers are B, B, C, C. Okay. All right. Okay. Most of the answers are B. Some are C. Okay. Let's check out the answer. So the answer for this question is actually C. It's pneumatic otoscopy for this patient. So it's not the tuning fork test, unfortunately. Okay, for the second case, 78-year-old woman has difficulty understanding conversations in noisy environments. She's referred for audiology evaluation. Audiometry results mild hearing loss at low frequencies, sloping to profound loss at high frequencies, hearing threshold for air and bone conduction, overlap, speech discrimination, 83% in right ear and 85% in their left. Which of the following is the most likely cause of this patient's hearing loss? Is it A, conductive hearing loss? Is it B, central auditory processing disorder? Or C, sensorineural hearing loss? Or D, is it Meniere's disease? You guys can write your answers on the chat. Okay, most of the question, most of the answers are C. Okay, and let's check out the answer. Answer is correct. The answer is C, sensorineural hearing loss. Right. The third case, it's a 63-year-old man comes to the office for a follow-up that is related to an audiogram done 1 week ago. The audiogram indicates moderate mixed hearing loss. The air-bone gap indicates a component of conductive hearing loss. The patient is interested in hearing amplification and requests a referral for hearing aids. So which one of the following is the best next step? Is it A, repeat audiogram in 3 months, B, refer to otolaryngologist, C, refer for standard acoustic hearing aid, or D, refer for bone anchored hearing aids? You guys can write your answers on the chat. Okay. We got mixed answers, A and B. Answer was an answer, that's D. All right, so the correct answer for this question is B, referral to otolaryngologist. All right. So this is the end of the presentation. Thank you guys so much for listening. So for our next presenter is for the topic of how to select a residency program is going to be Liena, Dr. Liena Babikr.
Yes,
thank you so much.
You're welcome.
Thank you so much.
You're welcome. Thank you, Dr. Nader.
Thank you, Dr. Yaseen. And before you start, Dr. Liena, I just want to add a couple of points. Thank you so much for the great presentation. The topic is important, and as we get older or as we see older patients, we know that some of them may have this difficulty with hearing, and this can have impact on their health and on their social health and clinical, as well as other aspects. So in the future, we will talk about it maybe more in great details, but it's the way of communication when you're dealing with older patients. As mentioned in this presentation, you want to use the skills that was mentioned here to slowly talk to the patient, during COVID, it's hard to show your lips. So some of the patient may be able to read your lips, especially when we are talking from other different countries with some accents. The older patient may not understand us well. So you want to repeat yourself, or you want to use different sentences. So instead of asking, do you have a headache? If they didn't get that question, you can point to the head and you can say, are you hurting? So you are trying to use the same question, but with different way of putting it for the patient, and using sign language or body language, so that you can get the message across or the question across. Sometimes you want to lower your mask so that they can be able to read your lips. In fact, I was seeing one patient last night, and she was coming off her, she had a shower, and I saw her later. She was talking to me, but she mentioned that her hearing aids, she did not put them on. So the communication was kind of awkward, because she was focusing on her hearing aids, and I was trying to ask her questions slowly and with the same technique that we just mentioned. So the best way is to make sure if they have hearing aid is to ask them to put it on, so that it makes communication easier. So this is one part. So thank you so much, Dr. Yaseen, for this great presentation. The other part is personal experience. A few years ago, I had some infection, and one of my ears, I had trouble with it. And it seems I had maybe an opening or a hole there. I'm going to share the screen. This is not my report, but I went to an ENT doctor, and they asked me to do the hearing test. So the hearing test, what they do is they give you sound. They put you in a small room, closed, and then you have some like a clicker. When they increase the volume of that sound, when you hear it, you click. So it depends on how many clicks and what the frequency they are using. And the report will be similar to something like this. And over time, they will try to fix whatever problem you have. And then they will test you again in 3 months, 6 months, something like that. And then they compare the reports. And in my case, I had some improvement, alhamdulillah. So it wasn't okay for me, just a small problem that was resolved. But this is how they do it. Thank you so much. Now you can go ahead, Dr. Liena, with the next topic.
Yes, assalamu alaikum. Hi, everyone. So I'm going to present here how to select a residency program. I would like to apologize first for any shortage, because I just signed up for this topic yesterday because of some circumstances being going on in my country about the war and stuff going around. So as we all know, that residency program is a 3 transitional years program that makes the medical school graduates, it makes them and prepares them to be an official professional physicians. So there are many things that we need to be aware of and consider about. We would like, when we are searching and looking for the best program for us, we have to look for the program that provides the best training, because this 3 years are the years that we are gonna learn a lot and it's gonna prepare us to be, as I said, a good physicians. So we need to find a program that really provides a good training for us. And that includes, like, we need to find a good like a mentorship, a good physicians, a good residents, colleague that would help and provide a good training for us. The other thing is like overall fit. And overall fit means like we would like to find ourselves are fitting among this group of physicians and residents. Because if that place, it doesn't fit us, or doesn't like I would say doesn't offer what we are looking for, that means we are like gonna lose a lot of time, and we are wasting our time on that program. And the other thing also is location. Many of residents doctors, they have families, or they have people who are depending on them. So it's really very important to find a place that can provide you having your family with you, or the people who supporting you, because this is really very important during this tough and busy time. And program structure is also very important, and it's one of the priorities that you have to look for. The mentorship opportunities also is one of the most important things that we have to look for. And salary, some people don't really worry about salary. They worry more about the training and the location, which I think it's the most important, more than salary, because we are here preparing ourselves for the future, being a good physicians. So we can just we can compromise things, and we are really in need to have a big salary. We can, if that's something from our priorities, we can go for that. But I think it's better to look for the best training program first, and the program structures and mentorship opportunities and those things. Some people, they are looking for things that for me, I think it's not important, but for some people, they think it's important. Like some people, they're looking for free parking lots, looking for free meals, free, free small things like that. But these are not really important. The most important thing is you get the benefit as much as you can from the medical and medical informations, training programs, learning tools, and those stuff. And at the end, you have to make a balance between all these things together. And as I so each one has his own priority. But the most important things are that frequently is the training and good environment around you. So there are many websites out there helping you to find and do a research for resources for finding a good residence program. One of them called Frida, and it's not free. It's provided by AMA, American Medical Association, and it provides many information in US about different programs that are provided out there. And the other one is Doximity. Doximity is a good for medical students as well as providers, and this program here, it coordinates and it has directions and many things that can help, and it has a lot of rich information that goes further to give you more information about living costs in the area that you look for doing residency at. I think that's all what I have all for you here. And as I said at the beginning, I'm so sorry for any shortage. And thank you so much for listening.
Excuse me, can you repeat the last point?
The docs in the websites.
Yes.
Yeah, there are many websites out there available for resources. One of them is Frida, and the other one is Doximity. Both of them are good. The Doximity one is really rich. It's rich in information. It does provide information for medical students and providers as well. And it goes further in information, like it does provide information about the living costs, how the rent, and those kind of.
I would like just to
answer.
add.
Yeah,
Sure.
sorry, go ahead.
No, yeah, I just wanted to add something also, that when we're searching for programs, obviously using these websites is very helpful, but also at the same time, while we're searching for programs, we need to go to the residency program website and check their information, because sometimes they do update their information from time to time. So, and they might not reflect on the website of like Freda or any other like any of these websites. And also like what I think is that it's very also important for us for like IMGs to figure out exactly, because some programs they would ask for only AMGs. So it would be a waste of time and money for us to apply for these programs if there is a high chance that they would not even like review that our applications. So basically for us, we're trying to get the best out of it. So that makes sense, I think. From my experience, basically.
Yeah. Thank you for the question. Yeah.
Of course, thank you.
I think Farida is free after you sign up and create profile, but I'm not 100% sure, but I think it's free. Anyone has input?
Okay, thank you for the addition.
Thank you so much, everyone. This is great. Thank you, Liena, for the presentation and the short notice, and thank you for participating. So yeah, I agree with all of you that I think you should start for those who are planning to apply to search about your programs of interest, so that you can make a list, and when you apply, you know exactly what you are applying for, and you get ready for these programs, because each program may focus on different things. So you want to study these programs and be ready for each one of them. And at the same time, you focus on their goals, on their missions, and so you can align your, let's say, personal statement, or when you have the interview, you get ready to match their goals, so that if you want, like for example, you want to create some connections in these programs, you can start for now. One thing I want to share with you is, I'm going to share the screen. So basically, so Doximity is this website where you have options mostly used by physicians, but medical students or even graduates. I think you can get into the website but you can also go to Farida. It's online. You can create an account with them, and there you can have your membership, or there are search programs. You can go there and you can search by program ID or specialty, and then you can list either fellowships, and residency grant, and medicine, and so forth. So when you go there, you will have more information about each program. What I suggest is to start. I'm going to show you here. Start a database or a way of making list of the programs that you are interested in. I created this program so that you can have an idea of what I'm talking about. So you will have the contact information for the program, the name of the program, let's say the program director or the contact person in that program, their phone numbers, websites, and maybe you can have some points or notes about each program. You can make sure, and let's say this area is good, or if you have family, it's not be a family-oriented program. And you can rate these programs. You can add as much as many information you want to, and it will help you when you want to make a list of which program you're going to apply, which specialties if you are interested in. And then when you have the interview, you can come back to this sheet, and you can add more information about the interviewer. If they have a list for you, let's say there are 3 doctors, they can interview you. So you search about them, their interests, their application, and make sure you know them. If you have connection to the residents, you want to try to see what's positive about the program and what the concerns or what the area they can work on to improve on. So when you have the interview, you can ask the program director or the faculty about what they think about what they plan about, let's say, how they increase or improve their scoring system of residents who go to subspecialty, if you are interested in subspecialty, something like that. So you will individualize each program, and you can make adjustment as you go on. But my advice is to start from now, collecting information so that you will be ready for the interview season. Thank you once again, Liena, and all the fellows contributed. Thanks.
You're welcome.
Hello, Dr. Nadir.
Hello, go ahead.
Hello, Dr. Nadir. Hello, everyone. Yes, I'm Maya, senior fellow. I want to add something. Dr. Nadir, when during my time when I start searching, and there's one website, Make Your Resident. That one is like not free. It's $100. Yeah, I paid $100, but that one is not like useful. Freda is more useful. And the other thing, when we all start searching program, we have to see clearly. Sometime like Caribbean student, they count in IMGs, and when we start searching the program, we have to also pay attention. Caribbean students also count in IMG, so we have to see in each program, like beside the Caribbeans, we have other IMGs or not. If a program only have IMGs, Caribbean student, I think that one is not helpful from my experience. I don't know how others find that helpful, but like, yeah, we also pay attention, like student from Caribbean also count IMGs. So we have to see also that one. We don't have to pay more attention the program that only have IMG as a Caribbean student. Thank you.
So in the past, some of the senior fellows, they share some of the programs that are IMG friendly. So they have some IMG in their programs as residents or graduates or community. but you want to look at these. I know some programs in New York, for example, and they have a lot of international medical graduates. Here in internal medicine, I know, and family medicine in Lansing, in Detroit also. So when you look at the program, as mentioned here, look at programs that they have some international medical graduates, or they accept, rather than you apply to a program that's limited, they don't accept international graduates as much, or as many. Thank you.
Yes, Dr. Adam, thank you so much.
Thank you so much, Dr. Anyone else wants to share their input or experience? Or any questions to the presenter? All right, interrupt me if you have questions or any comments. So for the next topic, I'm going to talk about the Pubmed, for example, as a search engine or database. So I'm going to share again. I'm going to start from, let's share my screen with you guys. So I'm gonna, so for me to explain the database, how it works for you guys, and how Pubmed works, and all this other database. So we're gonna start with Google Sheet. I'm gonna write sheets.new and enter, and it's supposed to create this sheet. So what happened is, for every articles or every published article, let's say, there will be a title, there will be authors, there will be journal, the page of the journal, edition of the year, and maybe language, beside other variables. So these, let's say, these are the common variables for this database. So when, let's say, Maya is writing an article, she submitted to JAMA. So here will be the Maya is the author, and JAMA is a journal. Then they accept the publication, and they, in the past, they printed in paper format journal, and it will be page 202 and the year 2023, and the language is English, for example. And the title, let's say, Telegeriatric Research Fellowship in 2023, whatever. So this will be the information about the article or the manuscript she submitted and accepted at JAMA in this year. So for me, let's say next year, I want to search for the articles that published in JAMA. I can go to the JAMA website, and then I can search for the title, if I remember the title, or I can search for the author if I know the author's name. So these are how they built the database. One additional factor is the key words. So, for example, she was talking in her topic about fellowship, about geriatric medicine, and then about, let's say, during COVID-19. So if I don't remember the name of the author or the title, I can search with keywords that meet my whatever I want to write about. So if I remember she was talking about the fellowship, I can just search about fellowship in 2023 in JAMA, or if I can limit that with the topic about geriatric medicine and COVID-19. So I will have at least some, let's say, 10 articles talking about these keywords. Out of these 10 articles, I can then limit them with the author Meyer, and then I can find the title. So this is how the database are built. If you have questions, interrupt me. If no, then I will go to the second part. So for me, I want to do the same now, but I want to see anything written about fellowship, anything written about geriatric medicine during COVID. So I'm going to go to Pubmed. So the Pubmed is a government website where they have all the published articles. This is it's a like National Library of Medicine here in the US, and sponsored by NIH. So I can use the keywords fellowship, geriatric medicine, and COVID, and then hit search. So I will have about 39 articles. So really on geriatric medicine, they didn't talk about fellowship. They didn't talk about fellowship here, controlling immune system. So they focused about here. We talked about geriatric psychiatry fellowship. So they want to improve that during COVID. So this seems to be impressive for me, for example. And then I will go to the next. Maybe this might be of interest. This might be of interest. So I have at least 3 articles or items that I selected that may be helpful for my, if I'm writing a manuscript. So I used the keywords. I found some articles and I can save these articles. There are different ways to save them. So you can save them as a text, or you can send them to yourself as emails, or the third option is to save them to a database of your own. By that, I mean, you can hit send. Here you can build your bibliography, or basically it's a list of articles that you are interested in, or collection. In the future, we will talk about citation manager and some of the programs that can be used for this. But for now, let's say I want to add it for my collections. To use this, you need to log in. So you need to make sure you are logged in so that it will be under your collection. Let me try if I can log in first. So let's see. Okay. So if you log in to the website, it will be easier for you to have your collection. So I have the 3 items I want to send to my collections. Now I can either create a new collection. I can add a name to fellowship and geriatric medicine during COVID, let's say. So if I create this, it will be like a folder. And in this folder, there are certain items. So I added the 3 items. So I have my folder will be saved for me. And this folder has 3 items. So whenever I want to look at these 3 items, I can come back to them again and read them. If I want to use them as references, then I have them available for me. These are free articles, so you can get them from this website. This is also free. This is free. So if you click on one of them, it will have the option of seeing it as a free article, if the full text. It's gonna be connected to another website. So if you hit full text link, it will go to the website here. And it will open this one for you. You can download the article as a PDF, or if you want just to read it, you can read it here. This is how you get the full detail of that article. Can I go back to the so So this is how you collect the information about certain articles, published articles, and you save them for future. Let's say I want to write a poster or an abstract. So I will look at what's written in the literature. So I'm gonna search about the topic. When I find some good articles, I can look at them and save them. And then when I have time, I can read them and then see what's the gap. This is what we talk about when you come up with an idea, research idea. You want to make sure no one else come with the same idea in the past, because it's going to be a repetition. If you find someone who came with the same idea in the past, see what can you modify their work so that you can come up with some modification. If they did it in the past, maybe you can repeat the same in the future. So you can do it in 2023. Let's say if they talk about some certain topic in 2019 or 2020. So you have a little bit of difference in the timing. If they talk about the same topic, but in, let's say in Africa, you want to repeat the same topic, but in the US or in South America, for example. Here in the US, if they talk about something in New York State, maybe you can apply the same concept, but apply to Michigan State. See, so you can play with the timing, time period, you can play with the geographical area, location. You can use other variables to see how you can modify things. This is how you search Pubmed to get the references for your work, what we call the background. So when you write an abstract or when you write a manuscript, usually the first section will be an idea about, you give the reader some background of what you are going to do. So you tell them, in the past, people did this, this, and here's the part where it's missing. This is what I'm going to bring to the table, what I'm going to bring as a new thing. So for you to do that, you need to give the reader some points, some information about the background or the impact or the significance of the topic that you want to talk about. And how you get this introduction of this background by reading in the literature. So you want to search the literature, you can use this website, or you can use different websites that will basically be the same. They have the database. You want to search the database. You can use keywords, you can use the author name, or you can use the title. You can use different filtering. This is a filter, so you can use different options, time period, for example, if you want to focus only on reviews or maybe systematic review, something like that. So if I'm interested in just give me the cream of the stuff, so you go to the systematic review and it can just, maybe I want just the review. I may give you 1 or 2, 5 articles. So it's going to be limited, but it's going to give you some substance that you can read faster and know what's going on to help you understand the background of the thing that you want to talk. We can talk about it later on in this fellowship, but you want at least to get 3 main points in your introduction. Let's say I want to talk about let's see an example, for example. So in this fellowship, fellows in the past published some articles, some abstracts, and some posters. So we can look at one. This is a website for us. So we can look at some of the abstracts that was published. Let's say Alzheimer's session. Let's say this one. So this is a group of fellows who work on this poster, and it's presented in the American Geriatric Society in 2022. So it's a call for utilizing various screening tools in dementia diagnosis. So this is the title. This is the authors and the time when they presented it. So they presented it as a video format, but basically they have to focus on the introduction, why this is important. So at least they mention 1, 2, 3 points. So the points they want to make sure dementia is common, and it's a common disease. It's affecting a lot of patients here in the US or in the world. It has impact, and the diagnosis, and there are some tools, for example, to screen for it, and some work has been done. So this is the background of the problem, or to give the reader some information to tell them what we are going to talk about or what we are going to study. And then comes the aim of the study, and then the rest of it will be the methods, the results, and the conclusion of the recommendation. So this is how they build the abstract, and it will be the same for any paper. If you want to write something, they will talk about the background of that problem, and then they will tell you what they are going to do, and then they go to the methods, how they can do that, or how did they do that. So this is how we search the database, but I want you to understand what the database is made of, or how they build it, first of all, so that you can search it. Any questions or any comments?
Yes, I have a question, Dr. Nadir. Yeah, this is Osama. I'd like to know, if you don't mind, how far should I go to search for the topic in the databases? So how many databases I have to search to make sure that the topic is not repeated? So I'm not going to do something again.
So there is no limitations. You can go as far as you can. But usually when you are talking about something new, you want to go at least 10 years. So within last 10 years, what people did. If you're searching for a topic, you can go further than that. What we do, for example, we can look at the abstract submitted to AGS in the last 10 years. And then out of this, we will focus on certain area. If you are interested in gastroenterology, maybe you can focus on certain topics within this area. You can say, hey, there are 1,000 abstract in the last 10 years. So I want to filter that. So this is how you do it. So I'm going to filter by the liver. I'm interested in the liver disease. So you put that, it's going to shrink or limit the list for you. So far, this is how you build the searching criteria for you. And the more keywords you use, the limited number you can find, so that you can read about. But there is no fixed like duration. But in general, I'll go back for the last 10 years, but people are saying. And it depends on the topic. So if you are talking, or you want to talk, or you want to search something related to COVID, for instance. So is it a new thing in COVID, or it's in the past before COVID? So if it's in the past before COVID, yeah, you can go 10, 15 years and see what people talked about, and then see what in the last few years after COVID, what if there is any similarity in topics, and then you can compare them. So it depends on what your question, and if it's related to something recent, and what method you want to use. If it's systematic review, you have to do searching all the way. If it's a new thing, like what they did in the screening tool, you can search within the let's say last 10 years or so, and see what people are using currently for screening dementia. If it's a new topic, then you don't have to go far, because most likely you will not find something 15, 20 years ago about that topic. For example, I'm interested in telemedicine. I can go all up to the 1960s, 1970, because it was used at that time for psychiatric patient or for patient in prison or certain systems or certain places in Arizona or in Texas. Let's say they used it at that time. So if I'm interested in writing something, I can go all the way. If I'm interested only in telemedicine used during COVID, then I don't have to go all the way. I can mention that the telemedicine was started in the 60s or 70s, and then during COVID it flourished, or the government opened the door for physicians. So I can refer to the recent government action. Let's say in 2020, the government approved using telemedicine for all patients. So I can just refer to that rule from the government. So in my background, I'd say telemedicine is a useful tool that's been in medicine for a long time, since the 1960s or 70s. But with the COVID emergency pandemic, I can just refer to the recent changes in the government rules and regulations and take it from the recent stuff, if that makes sense for you, Dr. Sana. Thanks for the question.
Yeah, thank you, Dr. Nani.
Any other questions or?
Hello, Dr. Nader.
Hello.
Eid Mubarak.
Eid Mubarak.
I wonder, like sometimes, like people when they're searching on Pubmed, sometimes they use meshworks instead of using keywords. So I wonder, like, what kind of advantages or benefits does it give to use the meshwork instead of keywords?
Excellent question. So when you are searching Pubmed, you can, it's like Google, you can search just freely, the same way we just use the keywords, or and sometimes it may give you a lot of feedback or items or results. So the mesh work is kind of working with very specific. So for example, if I want to say geriatric medicine, I want to limit it. So only geriatric medicine. I don't want them to give me results about internal medicine or family medicine, let's say, or pediatric medicine. So I can use not, and then I can use pediatric. So not here, it's kind of an informative keywords for the searching engine, so that when I get the result, it will filter it automatically to remove any results that has pediatric medicine in it, for example. Some other useful word is or. So I want to talk about geriatric medicine, but I know geriatric medicine is stemmed from either internal medicine or family medicine. So I want to search the topic about geriatric medicine, but I want to open it a little more. I want to include internal medicine and family medicine, because graduates from this discipline or this specialties go to the geriatric medicine. So if I want to open or widen my search to include only these topics, I can say all. But if I want to limit, I can say not, if that makes sense. When you say search, it will build on the side sometimes. It's not here, but it will build the mesh for you. And these are the limitation for the database to get the result for you. So 26 items showed up here for me, for example. So when you're using these are the tools that you can identify in the mesh work, if that makes sense for you. Does it make sense?
Yes, it does. Thank you so much.
You're welcome. Thank you. A good question. Any other questions? So, for example, if I want to look at this abstract or this paper here, Leading from the Heart, they publish it in this journal here, Pain Symptoms Management, Journal of Pain. And this is the year, this is the time of date and the page and the edition. And then the DOI or the ID number for this article here. It's a review article. These are the authors and the author's affiliation. If I want to see where they are from, John Hopkins and other institutions. And then it has another ID, which is Pubmed ID. So I can, if I want to save this information, I can just save it with one number about this article. Or if I want to use the DOI, it's another way of saving it with an ID. This is a document ID. And then the keywords the authors mentioned in their article. So they use palliative care, critical health, and mentorship. And the good news is this comes also with some similar articles. So when I'm talking about just the heart or the palliative care, and I have some results, it helped me pull some of similar results, either by the same authors or related to the same topic. So I have a couple of articles here. The publication type is review. This is mesh terms that used to collect this, and then you can get more information about this article. So this is how the variables are built in the system so that you can search by whatever you want to. I can search by the authors, by the title, by the journal, the year, and so forth. Any questions or any comments?
Yes, I have a question again, Dr. Nader.
Yes, go ahead.
Yeah, sorry guys for showing up twice. Is it mandatory for me to use more than one database when I'm trying to publish a paper? Like, can I just use PubMed, or I have to use more than database?
Good question. And again, it depends on what the topic and how you want to build the method. So, for example, some of the fellows in the past, what they did, they did a systematic review, the same article that was mentioned by the group here. I just shared with you about screening dementia. There are some tools. So for them, they did not limit themselves to only PubMed. They needed to go to other databases, so that when you're writing your poster or abstract or manuscript, you are telling the reader that you did your best to search all available articles in the literature using different search engine or different databases. So if you are talking about review of system, not review of system, systematic review, then yes, you need to do as many search engine or databases. But if you are writing, for example, I want to write a manuscript about, let's say, falls in Michigan in nursing homes during COVID. So I can only limit my searching to the PubMed. I will say, I found these articles talking about the falls in general, falls in all the others. Then maybe a couple of articles. I found them I found these articles talking about falls in Michigan, and then maybe one or two articles about COVID and falls in general. So these are my references for my introduction. So when I read these articles, I'll have an idea about how big is the problem during COVID and in the Michigan area, if there are some. If there are not, then I will mention in my introduction, because there is limited data talking about this topic in this area, we are going to investigate more. So my question will be, or my aim is to study the effect of COVID and falls and all the adults in Michigan area. So I'm going to do that. My method will be, let's say, I will do a questionnaire, or I will search the nursing homes database, something like that. So it's going to come the next step, which is the methods. But it depends on what the topic, what is research question, and how you want to carry on your topic or the research question, how you want to answer that. If it's a systematic review, then by all means you need to do thorough as much as you can search. So you want to use different searching engine. And if you look at most of this systematic review, they mention that we search 4 engines or we search 5 or whatever. Sometimes they mention the database, so they will say PubMed, Cochrane, and so forth. So they will tell you which database they search, and they collect, let's say, we found 951 articles in this topic. And some of them we removed because they were not in English. And then the rest will be our criteria for inclusion. It depends on, let's say, comparison studies. So if it's not comparison studies, we are not including something like that. These are the details of the method. But the first line or 2 lines, they will mention how many or which are the database they use to come to the articles, collect the articles in the topic. Does it make sense?
It does, yeah. Thank you, Dr.
You're welcome. Good question. Any other questions? Any other comments? If none, then I will drop the other topic, Canva. Maybe in the future we can discuss it. Maybe we can talk about the updates. I know Dr. Ryan is going to Boston tomorrow, and she's going to present after tomorrow one of the posters in the American the Neurological Association or the AAN 2023. Congratulations to you and your team. Anyone else wants to update us? I know some of you are working on some of developing apps. So I think Nafaz, you want to share if you have a minute, please go ahead. Or anyone else.
Yes, hello everyone. Hope everyone is doing good. Me and my team are working on an app on using the Glide app maker. The idea of the app is to be educational towards the parents about the vaccination programs that's recommended according to each age of the children, and also to kind of tackle down the idea of or misidea of the misunderstanding towards the vaccination and the benefits and the safety of vaccines. I'll share my screen. Yes. Okay. Our app, first, it's the recommendation. So as we can see here, we made it that when the parents or the caregiver chooses the age of the child, their recommended vaccine will appear, and they'll have an idea of what to expect in their vaccination visit. Our other idea is to give them brief information about vaccines, therefore the vaccine benefits and the vaccine safety. And also the aftercare of vaccines. As we know, the children, when they get vaccinated, they will have probably simple effects such as fever and pain, local pain, but sometimes we have very severe reactions such as the allergies. So these are some of the benefits and some of the safety. Some of the misunderstanding was that vaccines can cause autism, and we also tackled it down, saying that the side effects that are reported are very rare, and studies have shown no evidence relating vaccines to cause autism, diabetes, sudden infant death syndrome, or other illnesses. And also we gave them the references if someone wishes to discuss it or read it more. These are the effects after the vaccines. We provided them with the simple expected vaccine reactions, and also how to alleviate the pain afterwards. And in case of any severe reactions, to call 911, and such reaction would be include the symptoms of trouble breathing or swallowing, not moving, or very weak. They can't wake up, and or the parents, they think that their child is having a life-threatening emergency, they should call 911. And if your child experiences more serious side effects, they should seek medical attention immediately. We also provided a vaccine guideline for the parents to view from age birth to 4 to 6 years, just for extra knowledge. Our other part is to give them tips, especially the new parents, based on the breastfeeding, how often to breastfeed the child, how to breastfeed. We also provided a visual aid for breastfeeding, and also the signs of a hungry baby or when the baby is full. Also the benefits for the baby and the mother, and when should breastfeeding be avoided, such as the untreated tuberculosis, the mother having the HIV infection, active herpetic lesions or varicella infection, active substance or alcohol abuse, or some medications, and also to refer to the physician before using any medication during breastfeeding. Also an alternative, but we didn't go deep into this. We prefer to mention that the parent should go to a lactation clinic to have a more one-on-one advice and to be more proper. And then we looked into the growth and development. Also, we mentioned that the CDC provided an app for the parents to have a digital monitoring of the child's milestones, and also provided an image for the simplified growth and development needed, and the red flags. If the parents sees, they should go to their physician. And also the importance of vitamin K and its role in avoiding or preventing the vitamin K deficiency bleeding in children. And it's only one shot. We mentioned this and we provide the references. And also they should avoid water, which is very important. Some parents, they're not aware that water should be avoided until 6 months of age. And after 6 months, we can give them small amounts of water. And also we looked into the weaning food which is used after 6 months to wean the babies. And this will include the fruits, vegetables, proteins, and dairy products, but the pasteurized dairy products, because the unpasteurized, which is we mentioned it in the food to avoid in weaning. Unpasteurized food and drinks may cause the patient at risk for harmful bacteria, such as also the honey, the food with added sugars and low-calorie sweeteners, sugar sweetener drinks, food high in salt and food high in mercury, such as the king mackerel, marlin, and swordfish. Cow's milk before 12 months should be avoided. Caffeinated drinks and juice before 12 months of age. And we also looked into the possibly high allergic food, such as the milk, eggs, fish, crustacean shellfish, wheat, soy, peanuts, and tree nuts. We mentioned that parents should refer to their specialized physician before introducing these foods to their children. We also provided the disclaimers and the goals of the app, which is to primarily educate, and it is meant to provide education means about the benefits and safety of vaccines and to assist new parents with information tips needed in early parenthood. This application is in no way a substitute for medical help. Please refer to your physician for further information. This was all about the app. It was made by Glide. It used the spreadsheet method. And I hope everyone can give me their feedback about anything they find missing or they would like to add, or any advice. Thank you.
Thank you so much. This is also a really great presentation and great work, actually. Thanks for sharing. This is a lot of work.
Thank you, Dr. Nader. It's always thanks to you and the team. It was very hard at first, but I'm glad that we pushed it and we were able to do this work.
Yeah, excellent, excellent. What are the next steps for you guys?
Our next step would be to just view if for any misspellings and also use the logo for our telegeriatric program to add it, and then we will launch it, and we'll be speaking to some physicians in the US so they can recommend it to their patients, and hopefully we will succeed in that.
Excellent. So my suggestion to you, I think I agree with you with steps. So I think first step is to look at if there is bugs or if there is improvement to, as you said, maybe spelling mistake or some. So to do that, you need some extra eyes. So I would refer to the other fellows in this program and see if they have time to look at it and see if they can give you feedback. So this might be an option, or in your program or other physicians from SAPA or from other communities, they can also have access and they can give you feedback as well. So if you get all this and do the improvement, then the next step is to make it a full completed product. And then, as you mentioned, maybe you can approach some of the physicians who deal with families and children in this group to see if they can give you feedback and use it. And then maybe you can upload that to either Google Play Store or maybe Apple Store so that it can be available to all people. My suggestions for improvement or in advance, or usually we start with a primary product like what you are doing, and then we will think about how can we improve it further and further, because I don't want you to be satisfied with the product when it's done and then stop there. If you look at iPhone, for example, they started with iPhone and then iPhone 2, 3, 5, and then now 10 and so forth. So there's always research in what's the product working and then how you can improve it further and further. So my suggestion for you, after we complete all this, next phase is how we can improve it further and further. So one suggestion is not to build it only on a text. I saw you had you presented some videos, but I think we as fellows in this program, you can ask who are whoever interested, you can create videos. Maybe you can create it in a Zoom, similar to what we are doing now. Maybe two of you will create a video where they can talk. One of you will be as a parent or questions, and then the other will be presenting as a physician or care provider. So the first one will ask, what about this? What the side effects? What this? And then we will be answering these questions. So it's going to be like 2-3 minutes video, but it's going to be condensed all the information instead of 1 page or 2 pages, because I think image is better than the text, but video is better than both of them. And people will listen, will watch the video, less likely to read all the side effects, all the information. If you want to get dynamic or product that's improving for the user. This is my suggestion. This can be done in the future, and you can involve as many fellows with medical interest, and they can put it in their CV that we developed this app, and they can talk about it, whoever participates. So let's say one of the fellows just created one of the videos, so he or she will tell during the interviews that, hey, we developed this app, we talked about this, and I created this video of education, something like that. So I think the potential is there to get it even better and better. But for now, I think it's very informative, very useful, and an excellent work. So continue, and if you need any help, let me know. Thank you.
Thank you so much, Nader. I like the ideas about the making the videos or making at least voice notes instead of the making the users read it. It will be easier for them to understand it. I also had one question that I forgot to mention is I don't fully understand the users sheet in the app.
Okay, so the user sheet in the app. Okay.
Yeah, so when I go to the users, I made it so that my data will include the name and the emails.
So you need to click on the plus on the right side, and then add photo, just write photo or image.
Okay.
And then done.
And image.
And then done. So basically, this is a basic table for the user. You need the name of the patient and the user, and maybe the email and the photo. Additional information you can collect, or if they want to, you don't have to do them. For example, phone number, name of the parent or the child, or whatever other information that you want to. But this is the basic. So the 3 items you need: the name, email, and photo. And then how you connect that to the app, do you know?
This is the users provided by the app itself.
Okay, so if you click in the middle, there is a layout. If you click on the layout in the middle.
Yes.
Yeah. And then on the, here, I think. Click users. On the circle where the vaccine app, here, click on it. So now on the right side, it's the sheet on the right side, all the way to the right, all the way to the right. More, So here's the user sheet.
Yeah.
So, and down below, you will find the name, the email, and then you can click on the image to assign the image, the photo, and click on the image again, and click on photo. And basically, that's it. You can add also in the table some roles. Is it a user? Is it a developer? Is it whatever? That can be done in the. You don't have it here. So if you click on data, and the plus sign on the right, and then you can add role, and then hit done. And then if you go back to the layout, then go to the, you can assign the role. And that's it. You can click outside the box, the profile box, or close the box, close the profile. So whenever a person log in, it's going to be their information in their profile. And down below, it will list the users for you.
In the app itself, in the data.
In the database. So user number 1, user number 2, user number 3 will be like added as rows.
Okay, thank you, Dr. Nader. Thank you so much. This was yeah. And also I had for the regarding the Glide app. For my understanding was that this app can be used for Google apps or Android phones and also for iPhones, because it's provided by the person himself by a link or a QR code, instead of them being able to search for it on the iOS platform or the Google Play platform. So is that correct? Okay. That's
correct. Yeah, it's a web-based, so it's like surfing the web or browsing the web. So it's a web-based. It's like a web page basically, but it has clicks on it. So you click and you go to the next page, and you click, you go back. So it doesn't have the functionality built in like the apps where there's, let's say, there are games. So some moving items, you click here and then you flash and then move somewhere. So like the games and so forth. It's not like that. It's just a displaying of information or videos or so. The interaction or interactive part will be just clicking on image or clicking on a link where they will open another page where they can either enter information or just display information. So it will be working on any device that has the capability of browsing or reading just like a page. So no limitation. iPhone, Android, PCs, laptop, tablets, any device can be used for these apps from Glide.
That's a good advantage. I was thinking about after we launch it, I can make a small poster with the instructions and what this app provides, and we can send it to physicians and they can provide it to their patients. They can provide to their patients and also with the QR code. So then it will be easier for them to scan it and use it.
Yeah. So if there are some residents, let's say, from the previous batch who went to pediatric, or if you know some pediatric physician in programs, and I'll advise you to contact them and share with them the app and see what they think from their perspective and from their patient's perspective. So if there's anything that can be modified, so we can do that modification right away.
Thank you, Dr. Nader. Thank you for the help and thank you for the updates for the future. And thank you guys for congratulating us. And I'll be providing some of you guys the link so you can check it out and give us your feedback. And thank you so much. Have a good day.
You're welcome. Thank you. And you can share it with me as well. Thank you so much, Mafaz and your team. Thanks. Anyone else wants to share their products or updates or questions or ideas?
Hello, Dr. Nader.
Hello, Dr. Go ahead.
Hi, Dr. Mafaz. I think you did a very great job, and I like how you're presenting the information in a very simple way. So I'm willing to collaborate with you to build this application in Codular to be able to upload it to Google Play. Also, there are some suggestions. So I suggest that to make your application more powerful, you should add certain functions like a share button. So parents can share with their physician some information, and also alarm. And maybe you can allow video calls in cases of emergencies if they want to call their physicians for any reason. Also, you can use ChatGPT. ChatGPT is great. It can give you a great suggestions for your application. If you allow me to just share my screen.
Yes.
So here I asked ChatGPT to suggest some suggestion for building vaccination adherence application. So it gave me some great 9 suggestions. I think you did some of these suggestions. So they suggest like personalized vaccination schedule, and then vaccination information. This is something that you already did. A vaccine locator. You can add some locations on a map, for example, a vaccine tracker. So parents and physician can track the vaccination status of their child. Vaccination reminders. This is what I just told you, like add some alarm functions, incentives and social support, education, emergency response. And of course, you can ask ChatGPT to like tell me more. They can tell you more than those suggestions that's already here. So this is what I wanted to share. Thank you so much.
Thank you, Dr. Amal. I really like your idea, and hopefully we can meet and discuss this even more details. Thank you so much.
Yes, of course, you can just contact me, and I'm very willing to build this application in Codular, inshallah.
Inshallah. Thank you so much.
You're welcome, Mufaz.
Excellent, excellent. And for those who are interested in family medicine or interested in internal medicine or any other disciplines, but for those who will be applying to this, I would suggest you develop a similar app with only for older adults. In the US, the vaccines are used for older people for shingles, for example, for pneumonia vaccine, flu vaccine, and other, let's say, COVID. So if we can develop similar one of you might lead the idea and build a team around that. So you can build, the information is already out there. You just need to put it in one place, similar to Mufaz and her team. It's not a difficult task. You can develop that, and then you can improve it the same way we just discussed. So if you can build a simple app for all the adults, and it can be used for, let's say, my parents. I want to see for my dad, he's in his 80s, what available vaccine he's supposed to get. So I'll check with this app. Oh, he needs his flu vaccine in October, November. So by that time, I need to contact his family doctor and take him for this vaccine. Pneumonia vaccine. He had his pneumonia vaccine 2 years ago, so he is not due until he's 5 years, something like that. So it can be very, very useful for older patients and their family members, so they can keep track and also improve their adherence to this recommendation on the CDC, for example. So, and again, it's going to help the community, the physicians, family physicians, internal medicine physicians, geriatrician, and we can approach them and see if they can share these apps with their patients or family members of their patients. This will help you in your application when you write your ERAS application. You will mention that our team built this app, and you can refer to the website where, similar to my father team built this app. They will have a link to the app, or if you build it and publish it in Google Store or Apple Store, then you mention that we built this app and we publish it in Google Store, and it's, let's say, for free, for example. So it's going to be volunteer work for you, your intellectual, your ability. You will be unique compared to other applicants to whatever program you are applying to. So it's a win-win situation for you guys. So if you want to develop similar app for all the adults, or maybe just adults in family medicine, internal medicine, also that can be an idea. So whoever wants to launch these ideas or these projects, you can contact either Amal or Mufaz to know how to. It's a simple thing. It's similar to the sheet that we just I showed you about the database. You will create a sheet, you create items, and then you fill in the information. You go to Glide app, and it will build the things for you. It's kind of just drag and drop. It's not coding, like you need to know a lot of backgrounds about how the develop or writing codes or programs. It's very, very easy. It needs some learning. The learning curve is like you just spend time. There are a lot of videos, and Amal can mention how she did her work in the past. So I wish you all the best. Whoever interested, just contact me or my father or family, and we can take it from there.
Hello.
Oh, sorry, go ahead, Al.
Hello, everyone. Hello, Dr. Nadir. My name is Ala Osama. I'm a new junior fellow. First, I would like to ask you if you can join me at some specific subgroups, because I recently joined to this. In the addition, I am willing to participate in this app on vaccination for adults. If you can let me, but recently junior. If anyone want to participate, I will be one of participate group participation. Thank you.
Excellent, Dr. Ala. Thanks and welcome to the program. So basically how it works, and maybe you can jump after me. So what we want someone like you to have an idea. So you already have the idea. So what you need to do is just be the leader for that idea. So you're gonna start a project. You're gonna be the project leader. Let's say in adults, we want to build an app for adults vaccination. So your job is to create a team. So you can, in WhatsApp, you can ask the others, hey, are you interested? Yes, then I will create a list of who are interested. They can contact you, and then you build your team. After you do that, then you can contact either Amal or Nafas and ask her, hey, how can we build this? So anyone can show you. You need to go to this website, lightapp.com, and then create an account, and then create your spreadsheet. So you're gonna do the basics of the layout, and then you and your team will put all the information required, and then you want to display it to the user. So you will work with your team as far as what colors, how you want to put this image, where you want to put this text, how many pages, what the titles for the pages and users, so forth. So it's not going to be a difficult task, but you can work with your team on that. And Amal or Nafas can show you. And there are a lot of videos of how you build this. It's only 2 to 5 minutes videos. And there is a community where if you stuck, you can just ask the question. One of the community in Glide app, they will give you the answer. Or if you Google it, or if you look at the previous questions, you will find some people stuck the same way like you, and how other people help them. So it's not going to be a difficult thing to build. So these are the steps that you want to do. You want to be the leader of the project. You get your team in place. You get the steps as far as what next, the task, and how you accomplish this. And Amal or Nafas, they can and their team can help you get step by step this done.
Thank you very much.
Great idea, Dr. Nadir. I want to be a part of it too. I want to participate in adult vaccine app. Thank you.
Excellent, excellent. Go ahead. So at least we have 2 for this project, but I think some of you sent in the chat that some of you are interested. So Maya, and so you can start building the team. Yeah, go ahead, Dr. Arshad.
Yeah, Assalamualaikum, Dr. Nadir. So I also want to be a part of this team for adult vaccination. So I might
So maybe,
collaborate with them.
yeah, maybe Allah and all of you can build the team, and then you can work together. So excellent. Rayyan? Maya? Sure, go ahead.
Sorry, I just wanted to connect with you about the research, the one that we did on social media as an educational tool for nursing home staff during the pandemic. So we're just waiting for the questionnaire from you so that we can start the data collection.
You're waiting for
the questionnaire.
From me?
Yeah, from the questionnaire. So you know how when we submitted it to PALTIC 23, we submitted the objective design and aim, but the results were due upon acceptance. So right now we just have to hand out the questionnaire so that we can collect the data. But remember, you and Dr. Akila were speaking with regarding the questionnaire, how you're going to provide it for us so that we can collect the data and proceed with the results.
I'm sure, yeah. So let me contact Dr. Akila and see, and we will get back to you. Unless I have it somewhere in my...
Okay, Dr. Akila, she's, alhamdulillah, she got accepted to the residency position. So because I was working with her on that, I'm going to head it up. So if you can disconnect with me, inshallah. Jazakallah khair.
Excellent. Thank you so much for raising, and thank you for taking the leadership role.
Of course, we're also looking for like 2 more people. So if anyone else is interested in working on this research, by all means, just reach out.
If you can give them a couple of sentences about the idea of the product. Sure, thanks.
I'll write it in the WhatsApp group then. Thank you, Dr.
Okay, no problem. Thank you so much. Anyone else? Any updates?
Hi, Dr. Nadir. So I just wanted to say that Dr. Mafaz and I, we are very willing to help anyone who wants to build an application. I also have a suggestion, like why don't we combine both adult and pediatric vaccinations in one application? So like there's, with a one button click, users can go to either page. So I'm not sure if this is good or not.
So I agree with you with the combination. There are two things. One, if you build the app to a specific group, your success might be better in targeting this group. So if you are targeting pediatric, so the parents or their children will love the app or the app. And in that app, what you can do is you can add a button with a link to the other app for the older, either adults or geriatric. And so you will have some link to the other app. That's one option, is to make them separate. So pediatric app for vaccination and another app for older, either adults, or another app for older adults, geriatric. So you will have that. So it's up to the parents if they want, if they have children, they just want the app for children. So they click, they go to your app. If they have parents as well, so from that app, they can click and go up to see all the adults app. So they will have multiple apps for certain groups. That's one way to do it. The other way is to combine, I think this is what you were referring to, all in one app. The problem is that it's going to be condensed in one place, and not everyone will be needing all the features. So for you to figure out how you can make it simple for the user to navigate within the app so that they can meet their needs. So if I have my kids, young ones, and I don't have my parents here, so for me, it's not going to be useful to put all the information about kids and adults and in one page or one area. I'd rather just focus on my kids, so I want this. So you can build the whole app, but you can put some pages or some categories where I can navigate within the app to go to the sections of all the others of myself, for example. So that's another way. This way will create your app to be a bigger one as far as data, the size of the app, and you may have feedback for improvement, let's say, from left and right. So as a developer, you're gonna get customers who are dealing with their parents, as well as customers who are dealing with their kids. If you think about that, and you are able to spend time handling all, well and good. But if in my situation, I'll be happy with parents and all the adults, for example. So I will handle, it's like specialization, I will handle only all the adults. I will divide the task for another app developer team to handle, like you, for example, people with their kids, so pediatric, something like that. So my preference is to get separate apps and then link them. So in your app, you can just put some links and it will go to the adult or geriatric app, and you can put an icon or a button on the other app so that they can, if they want or they have grandkids, they can link that to your app. And one thing is how you can share. You mentioned the sharing, so you can ask them to share it with their family members. So let's say other friends, so they can use WhatsApp or other means, emails or texting to the app. So it's going to be, my preference is to build one for geriatric, one for adults, and one for pediatric. So at least 3 apps, but you can link all of them in each app. So people will go depending on what their needs. If I'm only interested in pediatric, so for me, it's better just to focus on one app. If I have an extended family and I want to help my grandparents and my grandkids, then I can collect 3 apps in one. Or I can share these apps with family members who deal with all the adults, and then the other app with family members with new kids or something like that. This is my preference. The other option, if you want to condense or combine all in one place, that's another option. My option that I selected, it has another benefit, which is I can ask these fellows to be part of, let's say, Ala and other people interested. They will develop the app for adults, and then someone else, let's say, I just mention Arshad, for example, is interested in intermediate, maybe geriatric. So he and his group, other fellows, will be working similar to Ala in their geriatric app. So we created 2 new projects, one project for adults, one project for all the other geriatrics, and the fellows in the first group, they will work together in this app, and the other fellows in the other group will be working on the other or the geriatric app. So you created different opportunities for them, and they can work in teams so that each one has some task to do, and they can work together. So kind of creating opportunities for all the fellows to work in separate projects. The third or the other benefit is you can be part of the other adult project or the geriatric product. So you can mention in your resume that I built my own app with my team, and I participated in developing 2 other apps, like the Adult app and the Geriatric app, with other team members. So for you, you did not focus on only one product in your CV, for example. You will share, I did this, instead of I only did one product, if that makes sense. But you are open to see whatever direction you and the group wants to go. And
Thank you so much. Thank you so much, Dr. Nader. I strongly agree with you, especially that a very simple and user-friendly app is one of the most important things if we want our application to be published and to get positive reviews. And also it creates opportunities, as you said. So this is a great suggestion. Thank you so much.
You're welcome. Thank you. Thanks for sharing. Anyone else has question or comments or any? I know we passed the 2 hours for the Zoom meeting, but this is recorded. So anyone else has any questions, ideas, or comments or updates?
Hello, I would just like to add something. I like the idea of for Dr. Ahmed, but I also agree with you. Having 2 separate apps will give the other candidates a chance to gain a new skill. And this app, I just had to add that it seems very complicated, but once you start it, it's very simple. And I was thinking, since there are so many people very interested, and hopefully they can succeed in making the adult app, we can make a Zoom, or the next meeting, we can make a presentation regarding this and the steps needed to make it, for example, in the Glide app or the Codular app or other websites that can help them make the app. It will be easier and they can review it easier in the future if they get stuck. But also the community for the Glide app is also very helpful. So that's just adding this for the future. If you guys get stuck at any point, the community are very helpful. So we can also make the presentation.
Excellent. Thank you so much. So I agree with you. So if you, Mafaz, and the new the rest fellows in this app development, you can get together. And then maybe we can, as you mentioned, in the future, talk about how to build one. Amal mentioned that in previous meetings, but if you want to do it like a tutorial about step by step, I'm going to start the idea from scratch. I'm going to think about my variables, my database, my sheet, and then I'm going to put that in its Google Sheet, for example, and then I'll go to Glide app, create an account, and then build an app depending on my sheet. And then I'm going to add this, something like that. So you do it step by step. And if you want, you can refer to the videos done by Glide app themselves. So you can say, I'm going to do this. And for further information about these steps, you can link to this video. And then this I'm going to do. And then same like what we were discussing about the user table. You can find how to build the user table around the profile they have videos in the Glide app. So you will say for building an app with a user profile kind of approach, you can refer to this video from Glide app, how to, but here are the steps. So you go over the steps as a tutorial. So people can follow you, and some may need further or detailed instruction. They can go to the other videos from the Glide app, something like that. If you prefer to do that, that would be great. Let me know. We can add it to the next meeting or future meetings. Or if you want to get on the small group and you want to work with them, you can create an event or a Zoom meeting in a different time that fits all, and then you can do that. You can record that and make it available for other people as well. Thanks.
Thank you, Dr. Nader. I think if we make it as a presentation during our weekly meeting to reach more people, and more people will be able to gain access to that. And next week is my team's meet time,
right.
the orange team. Yeah.
So
I
why
can
don't
make
you
it
add
and
it?
glide
Yeah.
out. Yes.
Add it to the agenda, and then we will be happy to have you presenting you and your team. And it's going to be a tutorial kind of, do it step by step from scratch. So I have no idea with computers. I'm a physician, I'm a doctor. I went to medical school. I have no dealing with what's the sheet, what Excel. I no experience. So I want you to guide me step by step how to create Google account, how to get the spreadsheet in Google, so I can be comfortable starting from no user with no experience in sheets or database, and let alone developing the app, if that makes sense.
Yes, inshallah. Yeah. You can make it from scratch, so like just an email, and we'll make it, inshallah. Thank you so much, Dr. Nala.
Thank you and your team. Excellent. So we have new comers. We have some fellows who joined for today. So for these newcomers, why don't I leave the floor for you? Just jump in, let us know who you are, and introduce yourself. I know one mentioned in the message here, HS. So HS, I'm not sure if it's stand for, but this is a new fellow, just joined. So for the new fellows, this fellowship is basically a way of helping you develop your personality and your CV, your skill set, and hopefully you will be ready to handle the task in the future. We started with focusing on medical graduates who applied in the past through IRAS and did not succeed. So we want to help them polish or improve their CV and their experience, their research area and publication, and succeed in the next year when they apply again. But we extended that to other disciplines like graduates from dental school. And we are in the process of widening the participation from other here in the US, maybe nursing or social worker or other pharmacy, whoever is interested in joining to improve their personal skills or medical or dental or other, so that they can improve their CV and apply and get accepted to whatever program they are interested in. To do that, we focus on certain aspects. One of them is your confidence. So we do some presentation. So we divided you into teams. Each team, they have a lead or a team leader that will divide the task. One of them, how you present. So we have some materials that are ready that any fellow can present. Sometimes one fellow can present a topic, or maybe two or more, they can present the topic. Some of the slides are already made, some needs to be updated, or some you want to get the topic out of like the internet. You can figure out how you can get slides that are already made, or you can create your own slides PowerPoint presentation from scratch. The idea is to share, so you have the opportunity to teach us whatever you learned about the topic that you want to present. By doing it, you will have the skill of collecting data, analyzing and understanding, the skill of teaching, so you are teaching us, the skill of presentation, and hopefully the confidence that you will be able to present similar topics in the future in the area where you want to go to. Like if you get accepted into residency, you will be asked to present some topics. So we want you to be ready. So when that happens, you have the skills, you have the confidence to carry on with this task of presentation or doing skills. the other things that we focus on is other skills like interview skills. So we will talk about how we do mock interviews, how we get feedback from other fellows, and how we can improve on doing this in the future. There are other aspects in this fellowship. One of them is the innovation part, as Nafaz and Amal and the rest of the fellows were discussing just a few minutes ago about developing some apps, mobile apps that can be used in iPhone, Android phones, or any tablets or computer. So that can be used by some users. We were discussing apps for younger people like kids and vaccination and so forth. In the past, we developed app for INR, like patients on comedy. But in the future, we can develop apps in any area. So if you are interested, we will be discussing how to develop an app next week. So join us and you will learn how to. Then you come up with the idea, hey, I want to develop an app for patient with this. So we can help you, or at least you understand the steps, and then you create a team and then you develop the app. The good news is we have Amal and her team presented some and developed the app, and it's been accepted, and now it's on Google Play Store. So if you want, you can approach her and see how she did that, or you look at the product. It's an app that's free. You can link to it, app, or download it and use it. At this time, it's basically Android based. So for iPhones, you are not able to use it from Google Play, but we have a version that's based on Glide app, so you can look at that as well, and you can feel free to give feedback if you have any comments or ideas to improve that app. But you have the idea about how we develop that. If you do develop some apps, it's going to help you be a unique when you apply, when you put your resume to certain programs. When they see that you develop that application or mobile app to certain groups, they'll say, aha, that's the guy who developed this. So you will be a unique. Hopefully this will create a positive impact, and hopefully you will be one of the good candidates for the program that you wish to continue on apply to. This is just a concise, short version of what we do. We have other things we do, but in the future we can teach you a little bit, and we'll know more about the program. Anybody else? Anything else? Any other comments or?
Yes, Dr. Nadir, I already made a group, and I want to be lead this adult vaccine app group, and Dr. Mafaz, and I will have get the help from Dr. Mafaz and Dr. Amal, and we'll do group work. Yeah. And
excellent.
Thank you so much.
That's great. You're welcome. Thank you, Maya. Thanks.
Thank you so much.
You're welcome.
Dr. Nadir, sorry, are we going to go over Canva, or is that going to be the next meeting?
No, that's going to be next week. So we will just delay that for next week or in the future.
Perfect, because it's a really good app. I just used it. I made like a professional card to hand out at the conference with my picture information. So it's very useful if, inshallah, when we do the presentation, so everyone can benefit from it.
Do you mind if you present that or in the future? Or
if no one is willing to present it, I don't mind. I've worked with Canva a lot for a lot of different projects, so I can reach out to the group leader and present it for next week, inshallah.
That sounds good. So why don't you approach them and see if anyone interested? You can do 2 presenters for the same topic. You do a part and the other one.
Okay.
We can
Perfect.
do the other part on something. Yeah. Thank you so much. I really appreciate it.
Of course, thank you.
Yeah. Any other comments? Any other? I know there are some in the chat. Welcome all new ones. So Marwa was asking about the participation in the app development. So maybe you can contact Maya and Ala and the team. If you already developed WhatsApp group, they can reach out to you as well.
Yes, Doctor. Yes, Dr. Nader, I already posted in Telegeriatric group, but I think new fellows are not in that group. So I will again post it in that new fellows group.
Do you mind if you add the link in the chat? I think there are some people who are interested in the chat right now.
Yes, Dr. Nader. Yes, right.
All right. If there is no other questions, I think we arrived to the end of the meeting. I'd like to thank you all, presenters, moderator, and all the attendants for today's meeting. Thank you so much. And I wish you all the best, everyone. So we will see you next Saturday, inshallah. And hopefully we'll have a good meeting. I wish you all the best and have a Eid again. And for those in Sudan, I wish you safety and hopefully things will change to better. And we'll see you next week or in the future soon. Be safe. Thank you. Assalamu alaikum.
Thank you, Dr. Nader, and everyone have a great night or a great evening, I believe. All right, bye.
Bye.
Thank you, Dr. Nader.
Bye bye.
Thank you, everyone. Thank you, Dr. Nader. Assalamu alaikum.
Thank you.
Thank you, everyone.
Thank you.
Thank you, Doctor.
Thank you, Dr. Nader.
Thank you so much.
Thank you, Dr. Nader.
Thank you so much. Have a good one. Assalamu alaikum.